Welcome. In this short video, I will talk about value-based healthcare. Based on the research of Professor Michael Porter, value-based healthcare is a framework for restructuring healthcare systems around the globe with the reaching goal of value for patients. Patient value is defined as patient-relevant outcomes divided by the cost per patient across the full cycle of care in order to achieve these outcomes. Value-based healthcare focuses on maximizing the value of care for patients and reducing the cost of healthcare. Patients should be in the center of systems with the access to quality care monitored in terms of improved health outcomes and optimal costs. Healthcare should focus on the things patients actually care about: survival, quality of life, and rates of complications after care. Professor Porter described the transformation of the care to value-based healthcare based on the 6 elements. Care delivery should be organized around patients' medical conditions or segments of the population. Outcomes and costs should be measured for every patient. Reimbursement models should reward both better outcomes and efficiency of care, such as bundled payments. Regional delivery of care should organize around matching the correct provider, treatment, and setting. National centers of excellence should provide care for complex patients. An information technology system should be designed to support the major elements of the agenda. To define a process for value-driven care, the integrated care flow should be discussed. In this process, target evidence-based care is delivered via broadly accepted pathways or protocols to patient populations that are stratified according to their demographics, medical history, and genomics profile. By setting clear expectations and defining goals regarding cost to benefit of treatment, healthcare stakeholders can define and apply best practices in the context of value, rather than clinical benefits alone, thereby providing optimal care while reducing waste and containing costs. For example, for patients with cancer, their medical conditions included coexisting fatigue, immunodeficiency, and malnutrition. Success in treating cancer incorporates the combined effects of caring for all of these needs. As a result, it is important to shift the discussion from cost to value from a health economics perspective. That is, which therapeutic regimens offer the optimal clinical benefits relative to costs for specific population of patients. I strongly believe that implementation of value-based healthcare will increase patients' outcomes. Thank you very much for your attention.